So let me introduce Peter Palomino and Julie Bisi from DSS, who are going to walk us through this tonight. And if I can get to the right slide, why don't you guys take it over and just let me know what you want me to change the slides for you.
Okay, Paul, thank you very much. And to all the parents who are on this particular call tonight, and to all the individuals who are working pretty closely with Connecticut Parent Power, we appreciate the time to talk to you about the Child Care Development Fund Plan. For those who aren't aware, we have had prior discussions with Paul and a few of the individuals who are on this conference, on this webinar, in order to prepare the agenda. So let's move to the agenda.
Okay.
Our goal here at DSS is to try to do a short overview and then get into the following issues, which were identified by Paul and others who are participating, or even those who are not participating, and to ask a few questions. Our objective is pretty simple. We want to listen to some of the concerns and some of the pluses or minuses that you have experienced with regard to accessing child care and paying for child care. And we're doing this because Connecticut has a responsibility to apply for federal funds every 2 years. And we want to make sure the federal funds that come in to help support child care are spent wisely and help reach the individuals who are in most need of those services. So we're expecting tonight that many of the parents who are on this webinar are parents who probably have a real need for child care, or you may be child care providers and are providing care to families in your community. So let's move to the next slide, which is an overview. Now, I'm not going to read each of these goal statements, but what I want you to just take, as you read them yourself, I just want you to be aware that the federal government has established these goals for the federal dollars that states like Connecticut can access. And these are in federal law. These are not goals of our department. These are goals of the federal government, have been passed through legislation. And we have federal congressional people who help to set the laws in Washington, just like we do here in Connecticut. As you can see, the first bullet talks about needs of children and parents. The second bullet talks about parental choice in making decisions. And the third one talks about consumer education to help parents. So these are the types of things that we at the Department of Social Services, when we receive federal funds, need to ensure that these type of goals are being reached, and we're trying to help as many parents as possible. Let's turn to the next slide. The federal government also has defined a purpose, so we just went through goal statements. Now the federal government also identified a purpose statement, and it does talk about increasing availability, affordability, and quality, and those terms can mean a lot of different things to a lot of people, but basically the bullets below talk about providing financial assistance like we do through Care for Kids, providing different types of quality efforts, which we can talk in terms of helping child care providers become better trained and equipped to work with children. Talks there, the third bullet, about providing parents with a range of options to address their child care need. We know in Connecticut that parents, based on where they work or where they live, may have options, may not, depending on how much child care is available. So parents may choose child care centers, they may choose family daycare homes, or they may even choose their relatives to provide care. Regardless of what they choose, we want to make sure that the providers are being equipped and trained as well. So that's one of our, that's a purpose of the federal funds, and it's also a goal of our department. Let's move to the next slide. And the next slide is, and a lot of the conversations we've had with Paul and some of the parents prior to this meeting, there seems to be a lot of interest on the Care for Kids program. And the Care for Kids program, just as a quick reminder, provides child care financial assistance to parents who need child care because they're going to work or if they're a teenager, they're completing high school. That financial assistance gets paid to child care providers, and I think we have a few child care providers who work in family settings on the webinar tonight. So that's important that they understand too. What we have here for you is the actual priorities currently that are established in state law for the Care for Kids program. And these are important to know because there have been times in prior years where the state of Connecticut has had to close the Care for Kids program for certain families because of limited funds. But I wanted to let you know here that starting with the second bullet where it talks about parents receiving TFA cash assistance, if you had put the number 1 there, the priorities of services to families start there, and they go 1, 2, 3, 4, 5, and 6. So right now, our Care for Kids program is open to the parents receiving TFA cash assistance. It's open to parents whose formerly were on cash assistance who have their benefits discontinued. It's open to parents under the age of 20. We consider those our teenage parents who are looking for help in order to complete high school. And it's open to working parents who have an income below 50% of the state median income level. So right now, those are the 4 categories that our Care for Kids program is open to. The last 2 is allowed, and we open those other 2 priority groups if we have additional funds or available funds to serve families. As you introduce yourselves tonight or ask questions, you may help us in understanding which of those 4 categories do you fall into. Are you a teen parent? Are you a parent on cash assistance who is in training? Are you a working parent? And it'd be good for us to know which of you are in that particular category, or if you are a family provider or any other type of child care provider. We'd like to know that as well. The other piece of the Care for Kids program, and what's very important, is that you have to have a child care need. And when I say a child care need, that means that you're either in you're on cash assistance and you're in a training program in order to improve your skills, or if you're working, you have a job. And the child care need means that the Care for Kids program provides the child care financial assistance for the hours when you're working or for the hours you're in that type of training program. Now, there may be other clarifications that we can get into as we go through the rest of the webinar tonight, but I just wanted you to understand those are our current priorities. And those are established in state law, and they are supported by the federal funds that come to Connecticut. So before I go any further, let's go to the next slide, because I think our first slide that we wanted to open up for your questions or your comments has to do with the Care for Kids application process. Some of you, I think, are involved with Care for Kids, and we wanted to spend time on this particular area and give you an opportunity to tell us how the application process works or doesn't work, what are some of the things that you like about it, dislike about it. This is our chance to hear from you. So I'll turn it back to you, Paul, to help facilitate the next part of this webinar.
Okay, so again, a number of you have muted your phones, which is a good thing to do. If you want to participate in the discussion, press *7. I think it's a small number of people here, so why don't you just speak up and ask your question or make your comment if you'd like to. So anybody want to respond to the question about the length of the approval process and how it affects your choice of child care? All right. Well, we've heard some reports from folks that it's often difficult, that there's a long waiting period, there's confusion about the various forms, and family child care providers often end up taking in families hoping and expecting that they'll be approved, and it might go on 6 weeks or 8 weeks, and then they get a denial for some reason. And the provider isn't able to get paid through Care for Kids, and generally the providers are compassionate enough and they don't really have any leverage over the families, so that essentially they've foregone income for 2 months or so and never recover from that.
Paul, if there's child care providers on the line tonight, it may be helpful also for them to comment about, because there is a parent-provider form that has to be completed as part of the application process. So if there are any providers who'd like to offer their feedback, we'd appreciate that as well.
Okay, anybody want to unmute with *7 and comment? I think people are bashful tonight. All right, should we move on to the next question then?
Well, Paul, before we do that, let me just share just to respond to your question,
okay.
For those who may not want to talk, is that I can share that the application process may take upwards to 2 and 3 months, depending on a number of factors. One could be right now that we have high volume, and to the extent that the staff can get to those applications, that's a challenge always. Another thing that we have heard occur on our end is that if the applications aren't filled completely, or if the parent-provider agreement is not completed and sent in, then we have to go back out and ask the parents for more information. One of the things that becomes a constant issue that we've heard from our staff is the inability to document wages or provide wages to document that there's actually working going on. We do have other ways to verify parents if they're on cash assistance, if they're a foster parent and have foster kids. So there are ways to do that behind the scenes, but and I think, as you said, it can be difficult, it can be complex, and I think we depend a lot on child care providers to help introduce and educate parents and work with parents to help complete the applications. In particular, the child care centers do a very good job on that, and obviously it's in their best interest to do it because there's revenue that comes when the parent selects that child care program. So we realize that this is an ongoing concern. We have worked with the Care for Kids Advisory Committee to have the application reviewed, the parent-provider agreement reviewed. But sometimes there's a lot of information that has to be collected in order to fulfill our needs to make sure that we're spending the money wisely on parents. So it is true that some parents may select a child care provider. By the time the application is completed, we then have learned that the parent is ineligible because they have some source of income that they didn't provide to us, that we found out about it through other ways, and they're not eligible, yet the provider has taken that family in, and the provider then needs to negotiate then with the parent if they're going to collect any funds. And as you kind of indicated, in some cases the parent doesn't have the money to provide it, and it's up to the provider then to decide if they need to continue to provide care. So we'll recognize it and need to do more about it.
Okay, thank you.
So let's move to the next slide. Again, this was an issue that had surfaced from the parents that we talked with prior to tonight, and has to do with finding child care. We do know on our end that child care there are pockets and areas within the state where child care is limited to certain types of providers, and it does present a problem for parents. But I'd like to hear what parents have to say about this in particular.
And did somebody just join us?
Yes, this is Hyacinth.
Who is this?
Hyacinth.
Hi, Hyacinth. How are you?
Good, thank you.
Okay. So we had a little overview, and now we're getting in the staff talking with folks about what's going on.
I couldn't log on to the website.
Oh, I'm sorry.
So it's okay.
Okay.
We're talking right now, Hyacinth. This is Peter Palomino from the Department of Social Services.
Hi, Peter. Yes.
We're right now on a slide that's asking parents or whoever's on the webinar to talk about access to child care, in particular are parents able to find child care where they live or where they work? And if they're not, what would they recommend needs to be done in order to help parents?
Oh, okay, good, good.
And we have about, 10 or so folks on the line, and a number of people are muted, but you just have to press *7 to unmute if you want to talk about this.
This is Beverly. The question to me seems like, it would be more, I would choose something that is close to me so I can be able to go to work. So, definitely I would choose, I guess, accessible. Then, I would say accessible and then quality, and how much it costs, because I'm trying to drop off my child and then get to work, so as fast as I can.
So
that's my opinion.
Beverly, let me ask this question. I don't want to put any words in your mouth there, but if what's critical to you then as a working parent is having child care accessible, and that's probably a higher priority, but you'd love to have something that's accessible, high quality, and also affordable. That's your ultimate dream, but if you had choose one of the three, what's important to you right now is because of your work situation to have something that's accessible and close by to where you work.
Exactly.
I know that, and that's a dilemma for parents too, because I can understand clearly you want to have all of the above, but in some cases that particular child care setting may not have the quality, may not be accredited, for example, and some of you understand what that means in terms of having a quality center with quality staff. But those are some real issues, and what we like to encourage parents to do is to call 211 because they maintain a database on all of the child care settings throughout the state and can give you information on not only what the charges are, but if they're accredited and what types of services they offer. Now, that's only good if there's something available in the community where you work, and we know that is problematic. So the 211 child care database helps consumers and also helps our department with information as to where are the child care settings, because those are licensed settings that have been licensed by the Department of Public Health. So we know where they are across the state, and we know what the costs are. And, of course, some of those child care programs are only there because there's been a demand and there's been enough monies to keep those child care settings operating. But we're very aware that some of the family child care settings have started to close down because they can't earn enough money or they've decided to go into a different career. So those are real issues in front of our state in terms of trying to make sure that we have enough child care settings to meet the families who live in a variety of communities.
And Peter, the Child Care Development Fund pays for 211, right?
Yes, Paul. Some of the money that we use from the Child Care Federal Block Grant do support 211 child care. We also use some of the money to support the Connecticut Charts of Course training program that's for providers, and we use it obviously for the Care for Kids program that we just talked about a few minutes ago. But still, the funds that we receive and the funds that the state contributes are still limited to the significant demand. And I think to go back to Beverly's point, if we could have a child care settings that are accessible, are high quality, are affordable, wouldn't that be the dream of every parent to make sure that they have that available to them no matter where they live?
Okay, anybody else want to weigh in on this question, or should we move to the next one? Okay, well, we'll move on to the next question. And again, press *7 to unmute your phone. So the next question, for those of you who aren't online, has to do with parent education. And the question is, what information or action do you want to see regarding parent education pertaining to child care? And the kinds of things this could include is counseling for parents about choosing child care, providing data on types of child care and availability, fees, hours of operation, on what type of center it is. So Beverly, Hyacinth, and George.
Hello?
Yep, go ahead.
Okay. Yeah, I've been trying to get my sister to call in.
Okay.
She's been having some questions about this. In particular, like availability. Like she's been having trouble just finding places that are available, that's affordable, and like just something that fits her schedule.
Mm-hmm.
So definitely availability, and also the type of child care that's provided. So I think she would like something more like a family daycare or a home provider.
Mm-hmm.
So
what's the ages of her children, Rachel?
Huh?
What's the ages of the children?
2. She's 2. So she's been like looking in particular right now for like a preschool setting, like something that's for her age where she can be with kids that are her age, you know? So,
Well,
I don't know.
This response would be for anybody else who has the same kind of question. I think the 211 child care, if you just call it 211, they have listings of all the child care settings in the state, except for those, obviously, who are parents or relatives. But they have all licensed child care centers, licensed group homes, licensed family daycare settings, and they, to some degree, they even have identified programs that operate in schools that may not be licensed, but they have some information on that. And when you call, they do maintain data on if the particular program serves infant toddlers or preschool or school age. They'll give you information on costs. So it's easy as calling 211. Now, I think the problem, though, is getting back to the prior question, there may not be something available in your town or where you work, and that does present a challenge to the parent, depending on their ability to transport the children to and from child care. And, of course, businesses have not gone out of their way, unless you're a large company, to establish child care opportunities at the site of where you work. So you're raising a very important issue. And so parent education, we rely a lot on 211 child care to provide education on information with child care. We do, I think, rely a lot on child care providers who naturally just pick up information and work with parents, not only about what goes on in their child care program, but also in terms of how their child grows and develops within that child care setting. So we probably don't do a very good job, I got to be honest with you, in terms of being able to send materials to parents' homes. And it's usually not until you get into a child care program where then those staff of the child care programs begin to talk to you a little bit more about what your child is doing, what they're teaching their child about. So where we are limited in terms of how much money we have to spend, but we rely a lot on 211 child care to be the telephone, way of communicating with parents.
Oh, this is Beverly again. So what if I'm a new parent coming into Connecticut and I don't know about 211? How would I know about Care for Kids?
Well,
how would I know,
Yeah, that's a great question, and I think it happens through word of mouth or through whoever you interact with. Be it your first as a new parent to Connecticut, your first entree may be with a school because you have a child who's school eligible. It may be with a church because you have a religious affiliation with that church. And I think what I was saying before, we haven't done a great job of educating, religious institutions about child care in general. Some do their own child care and offer it in their religious affiliations here. So you've identified a great question. I don't have a solid answer for that.
Beverly, what happens in Middletown when you encounter parents and they're struggling around child care? What usually takes place?
Usually either word of mouth, or if they're new parents coming into Middletown, or if they don't know, about Care for Kids, it's like Peter said, word of mouth, or, they'll have some, is kids or kids, relatives.
Well, I would presume the social service agencies in Middletown would also direct them to 211.
George, I think that's an assumption that I can't confirm, because some of them are probably, some of them you would expect are astute to all that. And I'm glad you raised that, too, because that's one target group that we haven't reached out to in the past years, and we've added them to our list because there is an association of social service administrators for each town, and we've reached out to them to do a similar presentation like we're doing tonight to make sure they are aware of that. And all of those towns are included within the overall 211 database, but I can't confirm that they all know the ins and outs of how to reach child care. I think we can assume that because they're social service type people that they should be on top of that. But I can honestly tell you that we don't send brochures to each of those towns. We haven't done that as a practice. Maybe that's a strategy or something we need to be thinking about doing. So I'm kind of curious to see if there are any other strategies that you may recommend we consider to try to ensure that parents like the parent Beverly talked about can hear about this some way.
Well, we have a resource directory in Norwalk that we put in the libraries and we distribute to all the social service agencies, and 211 is prominent in there right on the first page.
So that's something that Norwalk has done on behalf of whom?
Well, the Early Childhood Council.
The Early Childhood Council.
Yeah.
And that's a great strategy.
The Discovery Grant, basically.
And there's a lot of Discovery Grant communities in Connecticut who may have their own strategies. And actually, we just met with the Discovery Grant coordinator the other day, so we're reaching out to them also in terms of introducing to them some of the issues we're talking about tonight.
I was wondering if you are able to contact the people who are on TANF through that.
Well, actually, every person on TANF, if they are mandatory to participate in some type of work activity, gets introduced to Care for Kids through the workforce investment boards. And because there are a number of families on TANF who are exempt from any type of work participation due to their disability or children under the age of 1 or a variety of other reasons. But for those who are required to participate in some type of work activity in order to help them get off of TANF, they are outreached and they are connected through the workforce investment boards and learn about Care for Kids. So we do have a relationship there with those organizations throughout the state.
Good.
Peter, little postcard size or 5.5, 8.5 flyers or poster stock say, questions about child care or resources for helping you raise your child, call 211, that were distributed in nail salons and hair salons and maybe grocery stores, maybe libraries, places where people go. That might be helpful.
I think those are good strategies. In fact, I just, the last couple of weeks or so, up here in the Hartford area, we have a minor league baseball team called the New Britain broadcasts, and I see more of those schedules all over the place no matter what store I go into.
Right.
And you know, it's a marketing piece that just, sends a strong message. So we'll definitely look into that, and that's something that we probably would work with our 211 child care organization that's managed by the United Way of Connecticut.
I was just wondering, under your parent education heading, do you get involved at all in parenting skills and literacy, that kind of thing?
We have not, George. I mean, in a direct way, to the extent that child care providers do that in their child care settings, that may occur, but we have not, as a department, so to speak, have not been directly supporting that. I guess maybe indirectly through provider training, to the extent that in the early learning standards that we do for infant toddlers, and we go out and train providers. We've been putting a push on getting providers who work with infants and toddlers educated about the early learning guidelines, and there is some literacy component in there. But we haven't taken that yet to parents, with the assumption that if the providers are trained, they in turn will work with the parents. So, I think the simple answer I have to say is not in a direct fashion, I guess, with regard to a particular, dedicated focus, I think you're asking about.
Yeah.
Anything else on this topic? Okay, let's move on to our last discussion question. And again, for folks who are not able to get to their computers, or their computers aren't able to log on, this is about, can somebody who just came on with kids in the background, first of all, hello, who are you? Thank you for muting yourselves, whoever you are. A question is about outreach. What are the best ways, and it's a continuation of the question we were just talking about, what are the best ways to tell parents what's available for them? Do child care providers help parents learn about services and programs? I guess those are two different questions. Peter, is there something behind those questions you were thinking about that you were trying to get at?
Well, in our last discussion, I think we started to hear from some of you as to what would be some good strategies. How do we reach out it? So I think we kind of covered it to some degree, but no, there wasn't anything hidden behind those. Okay. It just didn't. But I think I make an assumption here, and maybe I want to make sure it's not a faulty assumption, that child care providers really work closely with parents to help them not only understand what's available, but how do their kids learn, what do they learn about, and what do they teach them while they're in those child care settings. So I do make that assumption, and we rely a lot on that. And I think what we try to do is help our providers become better skilled by giving them opportunities to learn about early learning standards for infants and toddlers, to learn about training with children with disabilities. So I make those assumptions, and I'm just checking in to see if parents do get that type of education. And do they hear about it primarily from providers? I know there's other ways people learn about it besides providers, because there are other avenues. I'm hoping that when parents are applying for example, energy assistance, that within organizations that have multiple types of services, that they may also learn about that there's a child care service available or funding like Care for Kids around. But I don't know. I'm just making those assumptions. So I'm kind of checking to see if parents have any experience on this and what they can share with us tonight.
Well, I'm not a parent, but I think maybe like maybe using media tools, or like at the doctor's office. I know I see stuff sometimes, like at a doctor's office, brochures and stuff. But like pushing that stuff at the doctor's office, just letting parents know that it's available.
You raised a very good point about how much knowledge pediatricians have about community-based resources, because once the child is born...
Hold on one second, Peter. Somebody just came on who has a kid with them? If you press *6, you can mute your phone.
Okay.
Okay, who's that anyway? All right, we'll never find you.
Muted.
Okay, go ahead, Peter.
I guess I was responding to the last comment about doctor's offices, and that pediatricians are probably a good source to help educate with regard to access to child care services. I think some of them take it upon themselves, and there are some. We've worked indirectly with some pediatricians when we had the Healthy Child Care Connecticut initiative here going forward, and I think that's been somewhat limited lately, and there is work with a few pediatricians and nurses to try to keep them apprised of what's happening here, but we have not done a very good job of kind of educating them in any concerted way. So I think that would be another good strategy to consider.
Yeah, one thing you might look into is the Reach Out and Read, I believe it's called, where they get books to pediatrician's office, the child care provider in town gets books so that they hand them out to the children when they come in for their checkup, and maybe you could include something about 211 in the book,
That's a great thought, George. We are familiar with that program. I know in the prior years they have reached out to us for some funding to help support their initiatives statewide, along with a few other literacy programs. But like other things have occurred, it was kind of one of those one-time, one-shot opportunities.
Mm-hmm.
But I think you're right. A simple thing would be just offer the flyers to them. So I think we can definitely consider some of those options in terms of how to reach out and kind of share more information to other venues that may not be getting it as much. And again, part of this, I think, what I'm hearing you suggest too, it's not just about Care for Kids here. It's just about helping parents to talk to others about how they can help their children become better learners, or how to help parents work with their kids, at the early stages.
All right. Those early learning guidelines are really great for that, but that only reaches a certain number.
Right. Hey, Paul, there may have been some new people that got added in as we started there, so if there's any other questions that people want to ask.
Somebody's trying to ask something or comment.
This is Hyacinth, and I was going to say, with George mentioning books, that triggered a thought, and that was for us to use children's librarians and children's libraries, so that when parents go in with their children to the library, you can have it in the adult section too, but since the children's section is children focused, maybe we can disseminate the information also through our libraries.
That's a great suggestion and a great strategy. For those who aren't familiar, we do have a newsletter that is developed twice a year. University of Connecticut has been putting up a child care newsletter, and we've sent it out to libraries to do just that, to make it available in the children's library section. We've also sent it to child care providers too. But I think this is another strategy that I think we could work with our 211 child care colleagues, because there are some good materials that are quick to read and available to be shared with parents, or I think as Paul was suggesting, to give them a number where they can contact to do some follow-up, and that's what we're hoping parents will do when they call 211, is that'll be their first entree into talking about the issue and learning a little bit more about it. It doesn't mean that there's other places that they can't talk to, because in some cases, certain towns, and I'm thinking, George talked about Norwalk having an early childhood council, as do other towns. Some of them have the right people available to answer parent questions, and if they make themselves available, they can get better information from people in the town that they're talking to somebody from.
For anyone who just jumped on, it's to unmute is *7. And feel free to jump in on, we're talking about the access to child care, the application process for Care for Kids, parent education, infant toddler development, and outreach.
Nope. Sandra, are you still on?
Yes.
Okay. So you're a family child care provider. Have been doing that for 10 years, you told us. How do you help parents who you work with learn about services and programs?
Oh, my God. I remember I don't speak very well English. But
Doing fine.
I'm still educating me. So when the parents come to here, it's the reference all the time.
Mm-hmm.
So I never have a new parent the other place or the other state. So all the time is a reference, and all these speak Spanish. So I don't know. But I'm trying to study, workshop, and explain to parents everything. So they like that. When the providers study everything. Oh, sorry, but my English is bad.
Your English is fine.
Okay.
Do people get you materials in Spanish for your parents, or is that available, or is that a problem for you?
No, I'm translated by Google for some parents in English, because I have parents speak Spanish, but no read nothing in Spanish, so only in English.
Okay.
So I'm translated by Google. Sometimes my sons help me. I'm trying the both in English and Spanish.
Okay.
And with the kids, it's in Spanish or in English too.
Okay.
Yeah. And my workshop's in English, so no, it's good.
Paul, I know the individual talking has raised another important aspect there. We have Spanish information available for Care for Kids. We don't have a lot of other Spanish materials available for parent education and outreach. I'd have to double check. I think our 211 Child Care has some materials. I just don't know which ones they do have or don't have. But I think if we start talking about helping to educate parents, and I'm sure this may also the same at child care settings, depending on, they probably rely on staff who are bilingual, talk to the parents or the kids, and probably don't have a lot of written materials that are available in Spanish, is what my guess is.
Well, Peter, I wanted to give you an accolade. I saw the latest early learning guidelines, and I see now that you have the parent pullouts in both English and in Spanish, which is great.
George, first of all, I appreciate that, because that was clearly a statement made to us when we first developed the guidelines, and I know there was interest to have the full early learning guideline pack done in Spanish, and we were able to identify some funds and we worked with all our kin in Hamden to make sure that the parent handouts were done in Spanish. So we have done it in certain cases, but it hasn't been kind of a practice on an ongoing basis.
Mm-hmm.
And Peter, does 211 have Spanish-speaking staff?
Yes, they do.
Okay.
Yes.
So does Care for Kids.
Okay. Good to know.
Yeah, and they do accommodate other languages besides Spanish as well. They do have that line, that they have a telephone line system they can get into. But they do have staff with multiple languages.
Mm-hmm. Okay, that's great. Any other comments or questions?
Well, I wanted to talk about quality a little bit, but I certainly would like the parents and providers to get their questions in first.
You know, the one slide we forgot to put into the presentation was about infant-toddler development needs, which was something that, Paul, you may remember, was one of the other items that parents we worked with wanted to talk about. So if we can just get on the outreach slide, but ask if there were particular concerns that the parents wanted to raise about infant-toddler development needs, we would appreciate that. If not, we can open it up to any particular question that we haven't talked about, including what George just raised with regard to quality.
Well, my question regarding quality, excuse me, is that I was concerned that with the market rates and the market rate surveys and how much Care for Kids provides, whether it might, if it's not providing the same level of support that some of the other programs are, or the parents are paying in some other programs, that might it not tend to go to programs of lesser quality?
Well, the one way I can respond to that, George, is that we've been tracking where the payments are going in Care for Kids for a number of years now.
Mm-hmm.
And despite the rates not changing, and they haven't changed since 2002.
Right.
Well, I'm not trying to hide that, because that's a known fact, and you and others know about that. But what we've been able to see is that the number of children that are participating in licensed centers is pushing close to 60% now, than in the past, where we were about 70-75% of our kids selecting kith and kin providers. So we've seen a dramatic change in the types of child care settings that people are choosing with the Care for Kids reimbursement at the current rate.
Mm-hmm.
And again, we don't require the Care for Kids for the parent to choose an accredited site. It's, go back to Beverly's comment, if it's an accessible site and it's licensed, then that's okay in terms from Care for Kids perspective, because we're supporting that parent's need to find a site. They may not be accredited, they may not be the bells and whistles that you'd love to have, but the parents are still making those choices. The child care providers are still accepting that rate, and that's as much as I can share with you on that, because we don't really measure quality of the child care setting that the parent chooses.
Mm-hmm.
And I think I'm sure if we talk to a number of people, how one defines quality could vary, because even as you know, even a center that's accredited, if you really get inside it, they may not be a quality program. Where another program that's not accredited, may indeed have a lot more quality, and a lot depends on the staff, what staff are hired, what training they've received, what kind of interventions they have, and how the parent-child interaction goes on as well. So I don't have a great answer for you, other than to say that parents are selecting child care centers, which is a little bit different than they've been selecting in the past in terms of using relatives. And of course, a lot of times they choose relatives because of their work hours are not consistent with when the child care centers operate. So if they have night hours or weekend hours and child care centers aren't open, or family daycare programs aren't taking kids during those times, then they have no other choice but to use a relative or a family or friend. And again, that fulfills the Care for Kids need of making sure working parents are working. And it's another goal. It's a goal of the federal government. It's also a goal of the state to make sure that parents are working.
Thank you.
I have a question.
Okay.
My name is Veronica. I got on the boat 5 minutes ago.
Hey, Veronica.
Hi. I have a question about Care for Kids as far as the requirement for working. I was actually trying to get my daughter into a daycare program last September, and I was starting back school. That's why I wanted to get her into the program, because I work part-time and I'm back in school part-time as well. And I was told by the daycare provider that Care for Kids only pays when you're in school. And I was wondering if that was true.
No, that's not correct. Unless you are receiving cash assistance from our TANF program, that's the only time Care for Kids will pay for child care when you're attending school. It's because you are enrolled, because number one, you're receiving cash assistance, and number two, you're in an approved training program where you're going to end up getting a job as a result of that training program, and that has to be authorized by the Department of Labor. So other than that, Care for Kids will not pay for a parent, regardless of what their income is, to attend school.
Okay.
Now, what I think we've heard also is that some families, some parents are working, and then they are also going to school. And
that's my story.
And sometimes we'll pay only for the work hours. So if you work 8 to 12, 8 a.m. to 12 noon, and then you go to school from 1 to 4, and you want to have your child in care for the full day, and if you're not receiving cash assistance right now, Care for Kids would only pay for you to go to work for 8 to 12. You'd have to find another child care provider for the balance of the afternoon. And the reason for that is because right now, the Care for Kids one of the priorities for non-cash assistance families is only for working families. We know that presents hardships to people, and if this is your case, it does present a hardship because you still need to go to school in order to improve your skills, to get a better job, or to make more money. That's where there's limitations right now in terms of how much money we can use and where we're directing the funds currently.
Okay, so
does that help?
Yeah, it does. But are there any other options or any other services that I could utilize, or?
Well, the options that could be looked into would be, depending on the age of your child. If you had a preschool age child.
Yeah, she'll be 3.
And what community are you calling from?
I'm in Hamden.
Okay, so Hamden. Well, that presents a problem in some ways, but if there's a preschool program in Hamden that it's subsidized by the state of Connecticut, and having your child in there for the full day would not be a problem. You would have to pay a fee. There's limited number of subsidized centers, I believe, in Hamden. For example, if you were in New Haven, there's a school readiness program that takes in children of the age you mentioned, and you could have your child in there a full day and be working in an education and training, and there'd be no problem there at all because of the funding source and the funding rules that provide help for you. Your best bet, my suggestion to you, ma'am, would be to call 211 Child Care tomorrow. Call 211. Ask them what is available in Hamden that could help me, because I have a 3 or 4-year-old, and how much would it cost? And then you'd have to call up that individual program and find out if they would take your child. But Care for Kids would only, at this point, help reimburse during the hours when you're actually working.
Okay.
I don't know if there's any,
Peter, would she be eligible for
anything else available in Hamden, either through the local social services department or possibly through any church that you may belong to?
Peter, the magnet schools in New Haven have to take a certain number of kids outside of New Haven, and often that happens in their 3- and 4-year-old programs. Is that something she might be eligible for?
Well, I actually did put her into the lottery, but she didn't get in.
Okay.
Yeah, that's great. I'm glad you raised that one, Paul. There is, not all magnet schools or charter schools offer pre-K, but some that do. And I think 211 would also have that information about charter schools and magnet schools that have school programs.
All right. Any other comments or questions? we have a little wrap-up information for folks. All right, let's move on to that.
Okay. Well, let me just say a couple things. First, again, it's a big thank you for those who are participating and sharing some thoughts. I don't know. At some point, we're going to post our plan, and we'll alert Paul. It'll be on this particular web address. We're probably going to be posting it towards the middle or late April, but we'll let Paul know. And the reason we didn't share that with you tonight is because it's a pretty comprehensive document, and it would be pretty confusing to go through tonight. However, we'll introduce it to Paul, and we're interested, once this plan has been drafted and you could see what the state of Connecticut, how they're going to address the questions that the federal government has asked us. Once you review that, some of you may have follow-up questions or follow-up comments, and so we're suggesting, if there's interest on your part, to do a follow-up webinar. This was the first for us, and I know I found it to be very helpful, and it's an easy way to reach out to people across the state of Connecticut. So we're interested in doing that if you are, but despite that, we are going to have public hearings. Those public hearings will be in various parts of the state, and we'll introduce that information also on our website, and we'll let Paul know so he can pass it on to all of you, because our plan is due in July 1st to Washington. Now, let me just say this. Even though we're talking here about a formal plan and formal information that we as a department have to submit to Washington, Paul and George and others, participate in a lot of other forums within Connecticut and continue to communicate concerns and raise questions to state people as to what can help parents. So you always have that opportunity to work with Paul and others to kind of communicate that information. So I don't want you to think that this is a last time or a final opportunity to talk with us. So having said that, I will end and turn it back to Paul to provide any close-up. There's one other page, Paul, in the back you can flip to. Phone numbers for Julie or I, and emails if they like to email questions. If some of you feel more comfortable using email, we'll take those questions directly also. If you'd like to call us because you feel better talking to us one-on-one, we'll do that as well. So, Paul, I'll turn it back to you for any
thank you.
Closure.
Yep, and you can contact us here at Connecticut Parent Power as well at info@ctparentpower.org if you have any questions, and we can pass them on to Peter or Julie or other folks to help. And we'll be recording. We have recorded this webinar, and we'll be posting it up on our website and be getting information out to everybody about how they can share that with folks. And we appreciate your participation. This is really the second time we've tried to do this, and the first time we've tried to do this with me operating this. Last time we had somebody who was competent at it, so we're making our way through this. So we appreciate everybody's involvement. And I think those of you who are online, when we end the session, you'll get some sort of survey for you to fill out where you can comment about how this went. So if you could do that, we'd appreciate it. Beverly, do you want to add anything as the chair of our ECE committee?
Thank you for participating.
Okay, great. And thank you very much, everybody, and we'll keep talking about this. And thank you, Peter and Julie, for thinking about us and engaging us in the planning process, and we'll keep talking with you and spreading the word.
Thanks, Paul. I appreciate it very much.
Thank you.
Nice night.